Batch testing involves pooling samples from multiple people together and then testing them all at the same time. This method has been used as a way to quickly screen populations for everything from chlamydia to the Zika virus and now for COVID-19. With more, we're joined by Dr. Pravit Jha from the University of Toronto. Welcome back to your morning.
Good morning.
Over the weekend, the United States Food and Drug Administration approved the first COVID-19 batch test for use. This involves pooling nasal swabs and analyzing the results all at once. When would this kind of testing be effective, and when does it not work as well?
Well, when prevalence is low, meaning the number of people infected is quite small, then it's efficient because instead of testing a lot of people who are negative, you pool a few samples, test the batch, and only if that batch is positive, then you test each individual sample. So when prevalence is low, it makes sense. So it might make sense in some parts of Canada to think about this strategy. But in things like outbreaks, or if you're investigating clusters of new infections, or in high-risk people like healthcare workers or nursing staff, batch testing won't be as effective. You have to test each sample.
Yeah, too many positive results. A team in Halifax is experimenting with a kind of batch testing, and I found this fascinating. They use electronic barcodes to identify an individual within the pool so that, when there is a positive result, they can go back and find who it is immediately. But it's still 3 to 6 months away from any kind of approval by the researchers' own estimate. So are we, or will we ever get to the point here in Canada where batch testing is a necessity?
Well, I think batch testing is useful, but the main strategy for control of the epidemic has to be ongoing testing, both COVID testing for the active infection, which is the nasal swab and the PCR, the RNA test, but also moving to antibody testing. So this batch testing is useful, but the main strategy does involve making sure testing is available to the populations that need it, particularly when clusters of infections occur. That's, for example, out in Windsor, the cluster of infections in farm workers that has occurred. You need individual level testing to go out and find the clusters, help isolate the patients, and try to shut down the onward transmission. So batch testing is helpful, but it's not the only important thing that we need to do.
Right now, you are leading a nationwide study that tracks potential immunity to COVID-19 through antibodies. Will we someday be able to screen populations for immunity quickly, either through batch testing or otherwise?
We're quite a ways away from that. Our study, which is called the ABC study, is a national survey of 10,000 Canadians. And we're looking for antibodies that have occurred during the first peak, the first viral wave of the pandemic. And importantly, what we'll be doing is resurveying the population in September, October, so we can see whether if you had antibodies, whether you hang on to them, and if that protects against infection. All that research needs to go on first before we get anything close to this idea of an immunity passport. Right now, we don't know whether antibodies actually protect against infection or if it's in any way safe. And certainly we advise all the people to whom we'll get the results back that having an antibody does not mean that you can go out and kiss people on the street. It doesn't necessarily mean it's protection against the infection. So we're a ways away from knowing whether it's going to be actual immunity, but the research, I think, will be helpful to do so.
I'm so glad, Doctor, that you brought up that point, because I do think there's a lot of confusion around the issue of antibodies and if I've had it and I'm therefore permanently immune, and science just doesn't prove that.
Not yet. We're working on it, and I think these kind of studies will go a long way of knowing how much immunity there is in the population and what types of immunity are there.
It is fascinating research. Proud that it's being done here in Canada and that you're a part of it. Thanks so much for being with us again on Your Morning.
Happy to join. Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.